Welcome to ETMC TV and this physician consultation with Vivek Patel, MD, board-certified and fellowship-trained cardiothoracic surgeon at the ETMC Cardiovascular Institute. Dr. Patel will discuss treatment of heart valve disorders. Thank you for choosing ETMC TV.
Most heart valve disorders don't present as acute emergencies, meaning they take many years for those problems to develop. It's typically something that we have time to investigate and work up and figure out where to go from there. The most common symptom with heart valve disorders is shortness of breath. And it can range from anything from just mild shortness of breath during heavy physical exertion to severe shortness of breath at rest. And that really depends on how bad the valve is and how long the disorder has been there. Other symptoms include things like chest pain, dizziness, lightheadedness, sometimes passing out, palpitations or feeling that your heart is fluttering or racing really fast. They've shown that the survival, let's say, for a patient with severe valvular aortic stenosis is usually on the order of 3 to 5 years. So once you start developing symptoms from these heart valves, it's very important that you seek treatment for those promptly. Otherwise, your heart usually undergoes damage that can't be fixed. There are medicines that we can give patients to alleviate the strain and the stress on their heart, to reduce blood pressure, to control heart rate and things like that. Unfortunately, for most of the severe degenerative valvular disorders, there hasn't been shown any medical therapy that's been effective long-term in curing the disorder. So really, surgery is the only corrective procedure out there, meaning you're going in there, you're either removing or repairing a heart valve that's already inside your heart. Heart valve surgery has been around since the beginning of cardiac surgery, so we have, I would say, over 50 to 60 years of data to support what we're doing. Certainly, a lot of the products that we use have been out in the market for 15 or 20 years, and so we have good long-term data reliability on these things, meaning good 20-year plus outcomes for patients who have these types of procedures. There's certainly candidates for one and there's candidates for the other. And you know, the beauty of the conventional approach is, of course, it's a tried and true method, and there's many different varieties of pathology that we can fix through conventional means. Whereas in the minimally invasive approaches, we are somewhat limited in what we can do and the scope of what we can do. But for those people who are good candidates for that, they have excellent results similar to conventional surgery. Minimally invasive valve surgery is essentially the treatment of valve surgery using smaller access incisions to allow the same type of procedure to be done to treat diseases of heart valves. Typically, the incision for aortic valve, a minimally invasive aortic valve surgery, is done anterior in the right chest, and it's about a 3-inch incision that goes between the ribs, and we're able to replace the valve through that. Now, the mitral valve is located on the posterior back aspect of the heart, and so the incision is usually to your side, once again through the ribs, and about a 3-inch or so incision on the side of your chest. So, you know, the benefits really are decreased pain, usually decreased length of stay, decreased complications, and a lot of times a sooner return to recovery and to work. Whether you go by conventional or minimally invasive approaches, it's still a major surgical procedure. None of these procedures are done as an outpatient. They're all done as an inpatient, meaning you come in for the day of surgery typically. You have the surgery done. It typically requires a small stay in the intensive care unit, usually about 1 to 2 days, and a hospitalization usually of about 4 to 5 days after the procedure. We have a lot of aids to help people recover from these procedures. So there's inpatient physical therapy that helps with the patients immediately following the procedure and usually gets them out of bed, you know, and walking the first day after surgery. Recovery depends a lot upon how healthy you were before the procedure is done. So once again, if you get the surgery done earlier in the disease process, your recovery is typically better. Depending, once again, on how your physical activity is, you may need things like outpatient cardiac rehab, which we have excellent facilities for. You may need home health care. You may need inpatient cardiac rehab. Most people are back to almost all their activities by about 8 weeks after surgery. You know, typically after minimally invasive procedures, within 4 weeks, they're back to doing most of the things that they want. If you look at most of the studies performed on patients who've had valve surgery, they return to a normal life expectancy after having this procedure done. So you're taking a disease process that otherwise would have cut their life short and put them back on the pathway to leading a normal life.
Dr. Vivek Patel is a cardiothoracic surgeon at the ETMC Cardiovascular Institute. For more information, please call 903-535-6496 or 1-855-349-8258.
I did my medical school training in India. I did my general surgery residency at the University of Pennsylvania. I did a cardiothoracic fellowship at the University of Rochester, New York. I did an additional fellowship in advanced aortic surgery at the University of Pittsburgh before moving to Tyler in East Texas.